name is Jennifer, and my colleagues Anissa, Cardu, Sahil, and Sapana and I have done our presentation on depressive disorder. Here is the outline of the presentation. We will be talking about the background information and significance, the characteristics and symptoms, myths about depressive disorders, causes, the DSM-5 and depressive disorders, treatment and interventions, and the example of how depressive disorders is portrayed.
Depressive disorders are significant as they affect a wide range of individuals, ranging from younger individuals to elderly individuals and everyone in between. Now, speaking statistically, elderly individuals do experience a greater percentage of depressive disorders as compared to younger individuals, and this is through a variety of reasons, mainly due to cognitive functioning, as they do feel that they are older, not as adequate in society, and which leads to the demise of their mental state of well-being. Now, depressive disorders are commonly associated with depression, but they're not always depression. Depressive disorders could be many things, such as postpartum, where after the mother gives birth, they do experience a lot of depressive episodes as hormones are imbalancing and they are just trying to self-regulate their body after birth. Now, seasonal affectiveness disorder, as you can see in the second line, which is primarily due to a factor of the weather and the seasons changing. So mainly this is seen through the winter time. As seasons are colder, people tend to associate the darkness and the cold weather with negative thoughts, negative energy, which does lead to the demise of their mental state and well-being. Now, situational depression is primarily due to a situation, mostly a negative situation, which has occurred through the participant, and they do see negative thoughts associated with that. And they also range from moderate to severe, which also leads to mental and physical stress towards an individual. You can see that they do create an unsafe environment for the individual, which means that individuals can harm themselves and others around them. A lot of individuals who do experience depressive disorders end up keeping towards themselves, but not always in a quiet and safe environment. Some may resort to alcoholism, drugs, and all that sort of stuff, which can harm them. And also they tend to isolate themselves from society, which do not want to interact with other people. But there are also situations where people do carry on with their days without the slightest symptoms while interacting with others. And this means you're going to go to work, you're going to go to school, go to job, you're going to continue on with your day without having any issues or the slightest implications towards your colleagues or your friends that you do experience depressive disorders or episodes. Now, when you come home, it may be a total different story, as when you keep to yourself, you also express these feelings on a broader scale, because some people do feel that others are judging them. Now, depending on the certain type of depression you may have, it could be bipolar or any other sort of depression, the individual does experience moments of highs and lows. Now, this is through most depression. Primarily throughout your day, depressive disorders will have a negative impact throughout your life, but that is not true in a sense that your entire day you're going to be low. You will have periods of highs and lows. It may be for a couple of minutes you're going to forget about everything, you're going to have a great time, you hear a funny joke, have a good moment, but primarily you are going to be towards the lower aspect of the spectrum. But that does not exclude your moments of highs and lows. And depressive disorders are significant as individuals are usually affected all day, and the sufferance can last up to years. Now, this is not necessarily true for every type of depression or depressive disorder. In terms of seasonal affectiveness disorder, we can see it only lasts seasons. Throughout the summer months, a lot of these people are back to normal and continue with their everyday life like nothing ever happened to them. Also, interventions and programs are not fully being utilized by individuals. So this is very significant, as we do have programs such as Ontario Shores who do work with individuals to create a safe living environment for a broad range of problematic issues that do arise. Now, people may not be aware of these issues, or they're aware of them, they just don't want to go to them. It is very much significant because we do have these programs in place in Ontario and Canada, and we must be able to utilize them in terms of helping ourselves and helping the rate of return. By going to these programs, the rate of return may be substantially a lot better than these people going to a mental institution or even the hospital, where a lot of our resources are being used up there, which we can actually use less resources and get better results through these programs. As you can see, the Canadian lifetime prevalence is about 12.2% that people do experience these. At 12.2%, it's really significant, as almost a lot throughout the country, there are many people that experience that depressive disorders. Now, parents with depression give their child an increase of 40% chance to develop the disorder. So that line actually basically means that if you have a parent who is depressed or has any sort of these issues, they tend to leave these negative images and thoughts and send it down towards their children. Now, it doesn't mean every child is going to have depression if your parent is depressed, but you are at an increased risk for developing that. This is due to a lot of people seeing the world through their parents' eyes. A lot of children, adolescents, teens, even younger adults will see this and have a 40% chance of developing the same disorder or anything within the spectrum. Now, as a result, a prevailing disorder can become established within Ontario and Canada, which means that even if you stay in Ontario, Manitoba, any province here, these chances may or may not increase, but more or less you're still at about 40% if any one of your parents do experience depressive disorders. Now, looking at the common characteristics and symptoms of depressive disorders include difficulty concentrating, which means that you're focusing on a task at work, at school, your mind is somewhere else. In the back of your head, you're thinking about other sort of things, and you're not always completing your tasks with your 100% capabilities. This also leads to mental stress, and mental stress will further lead to physical and emotional pain. This is in the sense that you go to work, go to school, do your certain things that you need to get done. However, once you get home, you feel that your mind is heavy, super big, and you just can't focus on the little things that you need to do, which does cause a great impact on your work and yourself as a person, which leads to keeping to yourself and isolation, which is not a great thing to do as an individual, as keeping to oneself can very much hinder your progression as an individual. And it's going to lead to feelings of highs and lows, self-consciousness, and you're highly irritable. A lot of these things that people do not want upon themselves, but
I'm sure many of us have heard myths about depressive disorders, so let's go through some of them. Hard work beats depression. Throw yourself into work and you will feel better, they say. This may be true if you're having a bad day, however, it is not true in the case where someone is facing depression. Overworking can actually be a sign of depression itself, especially among men. It's not a real illness. Depression is one of the most prevalent disabilities, and it is a serious condition. It is a real illness which can be seen through abnormal activity levels in brain scans. Depression is just self-pity. People who are depressed are unable to help the way they feel, as it is a health problem related to changes in the brain. Help means drugs for life. Drug therapy is not the only way to relieve depressive symptoms. In fact, talk therapy works as well as drugs for mild to moderate depression. People who do take antidepressants, they are not going to be on them for their entire life. Depressed people cry a lot. This is not true. In fact, people become emotionally blank and feel worthless or useless, taking a toll on them and those around them. Depression is a part of aging. Depression is not a part of aging. However, there are events in life of elderly that cause temporary depressive symptoms, and these symptoms can include aches and pains or even changes in sleep patterns. Talking makes things worse. There is evidence that guided discussions with a professional can make things better, or even talking to someone you feel comfortable with can help you feel a bit relieved. Teens are unhappy by nature. Teens are not unhappy by nature, rather they are going through a difficult time in their life while they feel pressure to figure out their life while figuring out who they are as well. It is an emotional roller coaster which can in some cases lead to depression. Last but not least, depression is tough to treat. It is not tough to treat. It can be done through talk therapy and medication over some time. What are the causes for depressive disorders? Well, as a matter of fact, there are no exact causes for depressive disorders. Rather, they can occur for many different reasons from person to person. Some causes for depressive disorders are medical illness, so someone who had a medical illness themselves or someone close to them is ill, traumatic life-changing events such as an accident or death of a loved one, abuse, which can include physical or emotional, medications. Many medications have side effects of depressive symptoms, genetics, conflicts with loved ones, major life events such as losing a job, financial problems, divorce, retirement, getting comfortable with a new job, graduation, or even workplace discomfort. Also, social problems and substance abuse are large factors that affect depressive disorders.
Now let's look at the DSM-5 before going on to treatments and interventions. Depressive disorders include the following disorders, which are disruptive mood dysregulation disorder, major depressive disorder, also known as MDD, which includes major depressive episodes, dysthymia or dysthemia, premenstrual dysphoric disorder, substance medication-induced depressive disorder, and unspecified depressive disorders. All of these disorders have a common similarity among each other, which is sadness, empty, or irritable mood that is accompanied by somatic and cognitive changes that affects the individual's capacity to function. When diagnosing an individual with a depressive disorder, health professionals look for signs and symptoms and stuff, and this would require them to resort to the DSM-5 for proper diagnoses. For example, let's look at the diagnostic criteria for MDD, or also known as major depressive disorders. There are 5 criteria in total. Criteria A states that 5 or more of the following symptoms have been present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either depressed mood or loss of interest or pleasure. Now, criteria A lists 9 symptoms. These 9 are: 1. Depressed mood that is indicated by a subjective report or through observation. 2. The diminished interest or pleasure in all or almost all activities most of the day or nearly every day. That is also indicated by subjective report or observation. 3. A significant weight loss when not dieting or weight gain, or there is a decrease or increase in appetite. 4. Insomnia or hypersomnia. 5. Psychomotor agitation or retardation. 6. Fatigue or loss of energy. 7. Feeling of worthlessness or excessive or inappropriate guilt. 8. Diminished ability to think or concentrate or indecisiveness. And 9. Recurrent thoughts of death. Criteria B states that the symptoms cause clinically significant distress or impairment in social, occupational, and other important areas of functioning. Criteria C states that the episode is not attributable to the psychological effects of a substance or to another medical condition. Criteria D states that the occurrence of the major depressive episode is not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, or delusional disorder, or other specified or unspecified schizophrenia spectrum and other psychotic disorders. And then criteria E states that there are never been a manic episode or a hypomanic episode.
Treatments that can be used are prescription drugs. These drugs are used on patients that range from mild to severe cases of depression. The following drugs are amitriptyline, amoxicillin, and desipramine. Amitriptyline acts to increase serotonic and noradrenergic neurons, which then help inhibit the uptake of serotonin and noradrenaline. In a prospective single-blind randomized study of 31 patients, The study took 3 months long to assess the effectiveness of the drug on depression. 72.7 found the drug showing success in decreasing depression. Amoxicillin, which is a drug that's used for obsessive-compulsive neurosis. This drug works by increasing the level of chemicals like norepinephrine and serotonin in the brain. In a study, 15 patients were assigned the drug to assess the outcome. This study distributed a dosage of the drug on a 6-week period. The dosage ranged from 150 milligrams to 210 milligrams in the end of the study. Results showed increase in better mood and increase in performance overall. Indazapamine, which is another drug that is used to treat depression, works by elevating chemicals in the brain like norepinephrine and serotonin to achieve a balance that is related to mood. The study conducted a double-blind, randomized, placebo-controlled trial on 48 patients suffering from major depression. This study took 30 days to complete. The first part of the study was to assess up to 14 days. Significant improvements were seen in the 48 patients using the MADRS scale. After the 30 days of the study, the MADRS showed increase in positive behavior. Therapy is used on patients who experience delusions and hallucination and are in a state that antidepressant drugs do not work on them. We have electroconvulsive therapy, which is used on patients who are in the late stages of depression. Patients who are in the severe stages of depression and experience no appetite, lack of sleep, and productivity are the best candidates for this type of therapy. ECT shows great promise according to a study that conducted a series of studies to analyze the usefulness of this type of therapy. Based on 48 studies and 2,981 patients, the only side effects observed were mild amnesia in the first 3 days in 72% of the patients, but increased successful in mood and productivity afterwards.
In the media, Kanye West is a big celebrity and is a role model to some children. When he had his psychotic mental breakdown in front of thousands of people, he told the media he didn't trust anyone. This included doctors, as he thought they had a vendetta out for him. He finally explained about his psychotic depression, and as a celebrity, the media blew up this situation. They criticized how a person with such a large ego can suffer from depression. Media corporations prey on celebrities and blow up stories about their lives, not caring about how that actual individual is actually feeling. They use the fact that celebrities have a lot of money and should not be suffering from such disorders. However, they do not consider the individual situations outside of the media cameras. Depressive disorders are triggered by any situation or life event, and an individual in the media spotlight has their life under constant scrutiny. Pharmaceutical companies are broadcasting commercials and advertisements about their drugs, being able to allow individuals suffering from disorders such as depression to live ordinary lives again. They target working-class families, showing them the lives they can live when not suffering from depression and being able to spend quality time with their children and close family. However, these advertisements only broadcast the benefits of antidepressants. It does not show any side effects that may occur with taking the prescription drugs or the reliability if it actually works on the individual to treat their depression. Pharmaceutical companies only advertise to draw individuals to use their products. This increases their revenue, and they prey on the individuals suffering from these